and thank you for the wisdom of going to College of St. Benedict and getting your degree there in St. Joseph, Minnesota. I want to start with one of the issues that my colleagues were discussing, and that is the work that has to be done on drug treatment. And as someone who was a prosecutor for 8 years and led an office with one of the groundbreaking drug courts, I'm well aware of these challenges and also how treatment works, including in the case of my own dad. I was an original co-sponsor of the First Step Act. I think my colleagues who worked on that, including Senator Durbin, Senator Booker, which provides federal prisoners incentives to participate in programming, including in drug treatment. According to an analysis by the Justice Department, during 2021, more than 43,000 people in BOP custody participated in a drug treatment program. What steps has the Bureau taken to increase the availability of drug treatment programs?
Thank you, Senator, and thank you for the reference to my alma mater. Minnesota has a special spot in my heart. Thank you. So the First Step Act implementation is something that's very important to me and the Bureau. I know that the FSA programs and services are available to all in custody. I can't speak specifically to if there's been any expansion in...
You want to get closer to the microphone.
I can't speak specifically if there's been any expansion of the alcohol and drug program since the implementation of FSA. I do know that there are 85 structured evidence-based programs and many productive activities that fall into the First Step Act and implementation. I know that we have an RDAP program, which is our Residential Alcohol and Drug Treatment Program, that begins on the inside and then continues into our residential programs. But as you are well aware, substance abuse is often one of the drivers of criminality, and so I'm proud that the Bureau has those treatment programs inside.
Very good. Today I introduced a bipartisan bill with Senator Susan Collins to improve the treatment of pregnant women in custody. Karen Bass and Representative Guy Reschenthaler of Pennsylvania lead the bill in the House. It's bipartisan, obviously, in both chambers. Our bill ensures that women in federal custody receive access to the prenatal and postpartum care they need by requiring the BOP to develop policies to better house, transport, and provide access to care and nutrition. Do you agree that we should ensure that pregnant women in custody receive health care and nutrition commensurate with their needs?
Absolutely.
Okay, and will you commit to reviewing the bill?
Yes. Okay,
thank you. During the previous administration, along with others, I was very concerned about the apparent disparities in how the BOP determined eligibility for home confinement, particularly after we learned about Andrea Circlebear, a woman who had died in federal custody 4 weeks after giving birth while on a ventilator and having tested positive for COVID. Are you familiar with the case, and what steps has the Bureau of Prisons taken to prevent similar tragedies?
Thank you, Senator. I'm familiar with the case, it's not specifically in detail, but broadly, certainly. Again, we take the care and custody of those in our custody very seriously. CARES Act review, I know there have been concerns around the pattern risk assessment that has been utilized and maybe not being as gender responsive or responsive to minorities. I know that that has been under review by NIJ and is currently under review right now and looking at being revalidated.
All right. Please look at the bill Senator Collins and I introduced, and I hope that'll be helpful. Another topic, I've heard from the constituents in my state about some of the workforce issues in Minnesota at our federal prisons. We have a very low unemployment rate in Minnesota. It's in the 1% range. And officers are working many overtime shifts, and non-officer employees, including cooks, teachers, and nurses, are being forced to fill in for correctional officers. We know this is a problem throughout our economy. One of the reasons overall I'd like to see, yes, training and apprenticeships programs, but also immigration reform. What steps are you taking to increase recruitment and employee retention rates, especially in more rural facilities?
Thank you, Senator. The staffing issues in our more rural facilities, of course, are more highlighted. We've been working really hard to improve recruitment and retention, both recruitment bonuses in the light of the current economy and retention bonuses. We've also consulted with an outside firm who just concluded their work and their recommendations around how we can better recruit, including how we market ourselves in order to get people inside. Plus, the issue around augmentation is one that's just incredibly important for me to touch on. It is something that is very useful during the short term, during a crisis, to be able to have those individuals ensure that those security posts are filled. But the wear and tear that's occurred organizationally and on individuals during the pandemic, it's just been too much.
Okay, I have another question that I'll just say for the record, Mr. Chairman, on mental health based on a bill that Senator Cornyn and I introduced. I also wanted to mention I was talking about the First Step Act in my first question, and I note that our ranking member, Senator Grassley, was the lead Republican. So thank to him as well.
Thanks, Senator Klobuchar. Senator